Certainly, the idea of user and care involvement in nurse education has been going around for quite a period of time, and I suppose my view would be that if we can, the more people who are involved in health and social care provision we have at the earliest onset of student nurses training and preparation, then the more beneficial nursing practice is going to be. So from that point of view, it's very, very important we have users and carers having a say in the formulation of curriculum, in the development of curriculum, and indeed the approval of curriculum. And then from that point, if we have their involvement in the actual implementation of the curriculum, then we can actually see we're capturing their views and thoughts and so forth, and then obviously in the review process of that curriculum. But more importantly, I think as the curriculum unfolds and is implemented and so forth, students will get used to the idea from a very early point in their nursing career that the voice and the views and the thoughts of service users and carers is paramount. Not paramount, but is as important as anybody else and so forth. And that's the message which we want to sort of engender within all of our students. And from that premise, we would argue, and certainly the literature argues, that once it's ingrained in their thinking in the pre-registration level, then when they go on to qualify and graduate and they start to work with students in the longer term and so forth, capturing the views and thoughts of users and carers has just been a normal part of the day-to-day practice. And of course, if we get to the point where the voice of students, the voice of users and carers, and the voice of practitioners are all working together in transit, then we're in a much, much better place than we are maybe currently or certainly hitherto. Yeah, that's an interesting question too, because it's very much unknown territory. But we do have a little bit of expertise from the point of view that it's not that long ago since the voice of students maybe wasn't as heard as loudly as it currently is and has been for maybe the last few years. And indeed the voice of nurses working in the clinical setting, their voice needs to happen captured in the preparation of students as well. And that's now quite a normal feature of any of our curriculum and so forth. Mm-hmm. So similarly, capturing the voice of service users will be the same process. I mean, we'll have the same challenges in encouraging service users to become involved, and at the same time, we're not really sure as nurse educationists what it is that we want them to do. But however, we will listen, we will learn, and we will learn from other universities and learn from the experience of other institutions like ourselves. And I think as we grow together, we'll certainly be more aware and more understanding of what and how service users can contribute to the process, and we'll put in place mechanisms to enable that contribution to be made. It started very carefully in terms of ensuring we had the right people on our group and so forth, and who can certainly articulate the voice of the service users and carers in a meaningful way. And being perfectly honest with you, we've actually let service users and carers set the agenda, and we've said this is the way we're going. We're committed to the process, and let's work together on finding how best you can contribute. First of all, the being involved with having service user and care involvement in their preparation program, both in terms of the university setting and their curriculum, will, as I said earlier, it will certainly plant the idea that the voice of service user and carers is also important. But probably more importantly, when students go on to qualify and graduate from university and become independent practitioners themselves, they'll be very mindful that the people they're working with, the voice of the people they're working with on a day-to-day level, have a view, and that view must be captured and thought about and considered when delivering nursing care. So it's a win-win situation for everybody. I mean, certainly nursing would be the better for it, and most importantly, the patient would be the better for it as well. Yeah, that's a very important question, because I think at the outset of this process, when we planned it and so we put in place where we want to be in 5 years' time, certainly this should be a service user and carer led process, and from that perspective, that the transfer of responsibility and accountability should be in the end should be with the service users and carers, and the direction should be provided by the school officer and so forth. So certainly my role, along with other teaching colleagues, is to encourage the greater accountability and responsibility of service users and carers in the group to take the lead and to drive this process forward, to encourage that.